September of 2011, PEPFAR and CDC Botswana collaborated with the Ministry of Health and Botho University to launch the District Health IT Officers Public-Private Partnership. This partnership was aimed at reinforcing the government's IT capacity to address health information system challenges. The partnership, funded by CDC Botswana, selected recent Botho University graduates to serve 1 to 3 year attachments as IT interns in health facilities. Cardno Emerging Markets provided program management services to inform program development, implementation, and monitoring and evaluation. Botswana has the world's second highest HIV prevalence rate of 25%. The application of IT tools is vital to ensure that accurate and real-time monitoring and evaluation takes place to effectively address public health challenges such as this. To address these challenges, the nation has initiated the rapid influx of health resources in recent years, which have overwhelmed its IT support infrastructure, leaving it to rely on ill-supported IT tools. Given the lack of IT expertise at the district level, IT support was identified as a critical gap that prevented districts from timely reporting and utilizing data for optimal service delivery. The partnership utilized the technical expertise from the following 5 types of interns to address this deficiency: MoH District IT Officer Interns, Central Medical Stores IT Interns, Institute of Health Sciences IT Interns, Software Developer Interns, and PIMS Help Desk Interns.
As part of the national HIV response, there's a need for the introduction of new information systems throughout the country. And the real lack that we identified was in terms of information technology support to keep these systems running. So the Botho College internship program allowed us to provide IT specialists throughout the country who could support these systems, and this was key to making sure that we had the information we needed to run the program.
We started off this project, a first of its kind in Botswana, with the partnership between us, CDC, when we started was Bothusa, and the Ministry of Health and Cardno. And I think this has been a very beneficial partnership to all the stakeholders concerned. Our expectation mainly was getting experience for these graduates who have just come out of studies. That was point number 1. And second was to help the health sector.
The real focus for CDC was on the PIMS system. PIMS is the Patient Information Management System, which is used at clinics and hospitals throughout the country. And so we really needed to make sure that system was operating well. And I think the greatest contribution of the interns was towards keeping the PIM system functional, because at the district level there isn't often much in terms of IT support. The interns really filled a critical gap, and that was key to running our programs.
The Ministry of Health, has a vision, excellence in quality health service provision, and this can only be achieved if all the 6 pillars of a health system are strengthened. And I'm happy to say that we, through the assistance from Botho University and CDC, by providing IT interns whom are now in the districts assisting with capturing of data into DHS, we are achieving one of the pillars which play a vital role towards improved or strengthened service delivery. The ministry had challenges with health information systems. In fact, our health information systems are actually fragmented. So there was a need to find ways of integrating systems. So we wanted support to encourage and enhance a flow of data from the facilities to the district to the national level, by ensuring that data is captured.
Since I got here, I have some of the duties that I've carried out, which include technical support, that is ensuring that there is network availability. I'm also doing training and mentoring for PIMS. I mentor new users. I train new users. I mentor the existing ones. I also ensure that data is entered into the system accurately, and data backup and reporting is done continuously.
As an IT graduate, there was a vast and mature way of handling things. For example, I gained confidence in my training sessions, of which involved around 30 people being trained by me. So I feel that my experience also in terms of networking, troubleshooting database problems, while I was helping clients through the phones, because I'm also a help desk officer, has really improved a lot.
Our role was to come up with the centralized system and then centralize the existing system so that information access is made easier across the country. The Ministry of Health gained a lot because coming up with a centralized system means that support is made easier because it can be supported from a single location, and then information access is also made easier because you don't have to take backups and combine them and come up with one database. So the system is already centralized. Now they can access information without having to combine any database backups. I came in as a graduate, and then I had to go through training. I was taught how to develop real-life applications, and then I had to develop a system that can work in the real world. And what I want to do from here is to upskill my level of knowledge so that I can develop more systems that can support the health sector.
The internship program provided a huge support to the ministry by ensuring that the data is entered at all levels, especially the clinics and the hospitals in the districts. So the benefit really there was the reduction in the turnaround time for support to those facilities. Those will be the central medical stores, the institutions of health sciences, and the clinics and hospitals themselves.
Since they came in, they came in at a point in time when I needed a group of people to help me push through activities that we were having at the logistics management unit of Central Medical Stores. And these activities entailed a lot of data collection from health facilities, analysis of this data, and dissemination of analyzed data to different stakeholders within the healthcare systems. So the interns came in at a point in time when there was little or nothing in place at the unit, and I needed them to be like the foundation set up, to form part of the foundation of setting up a system that will be durable and help, that a system that will also help Central Medical Stores in their data management.
Most of the work that we're doing was converting reports that are being received by CMS from facilities around the country. So the first application that we had to do when we came in was to develop a monthly reporting tool, which he was going to use to populate these reports into a database. After that, do some analysis with those for those reports. We managed to do that, and then the second tool that we had to develop was a quantification tool, which was going to be used by the CMS team to quantify for drugs that can be normally quantified. We are saying this is the amount that we are having at the moment, and this is what we might need maybe in 3 months, 6 months or so. So that was another tool that we were supposed to develop. And then the last tool that I developed was a vetting tool. A vetting tool, which me and Dr. Mark decided to call it a vet master, is a tool that can be used by the CMS people to vet their requisitions.
When we started, it was the intent was to get more data and on monitoring coming out of the systems that had been implemented. And I would say, I think CDC did well to appreciate the fact that the country has got so many qualified graduates who could be used in many instances. And PEPFAR through Cardno have also appreciated the fact. And in fact, what we started off with 20 graduates had expanded to 56 at one point in time because there were other civil societies who were brought in. Botho University has a very strong career services department who is constantly liaising with the industry and who tries to place all the graduates. Having got the experience of 2.5 years, I think these graduates, when they come out, are going to be extremely valuable to the whole industry and particularly the medical industry.
The following are the partnership's key results. A total of $2.4 million was contributed to the partnership, including in-kind contributions valued at $1.2 million leveraged from Botho University. Reduction in average system downtime from 7 days to 1 day across district health facilities in 27 supported districts. Increase in on-time LMIS reporting by district health facilities to CMS from 30.7% to 90.5%. Monitoring of PIMS performance through site visits to 276 PIMS sites between 2012 and 2015. On-site monitoring and training to over 2,200 PIMS users per year. 7 modules out of the existing PIMS modules were modified to create a web-based centralized system for aggregated data. 84 interns were recruited and trained through the program. 37 health facilities were supported by the program. 201 satellite facilities were supported by the interns through the program. And 23 of the interns were absorbed after the internship.